Good afternoon. This is Dr. Michael Joseph Deal. I'm a board certified psychiatrist and was also extensively trained in internal medicine, and also took part in a lot of research during my training programs, but found it too boring to continue in that vein. So this talk today is about sleep medicines. I think a very poorly understood group of medicines, which can be rather dangerous if improperly used, even unintentionally improperly used. There's just to recap slightly. If you've seen my very recent video on sleep disorders, the ones that are the two most common are restless leg syndrome and periodic limb movement disorder. Now there is sleep apnea, of course, but that's more of a mechanical disorder of your nose and airways. But the restless leg syndrome and the other one are based on receptor malfunction of dopamine 3 receptors in your brainstem and spinal cord. But these are the medicines that can be used to treat insomnia. So insomnia is the inability to go to sleep. It's not, and stay asleep. It's not a diagnosis in of itself. It's a symptom. So restless leg syndrome and periodic limb movement disorder involve millions of people that have these disorders. And the main drug I use for both those conditions is a drug called Requip, or Ropenolol is the generic name. And what these drugs are what are called dopamine agonists. That's a big name for a drug that affects a dopamine type receptor that sits in the brainstem and lower brainstem and upper spinal cord. And there are dopamine 3 receptors there which don't function properly. These drugs, or this drug, Requip, tries to get these receptors up and running better, and they do. So if you have one of these disorders, you may be offered Requip, which you take one pill 2 hours before bedtime, and after 5 nights, if you're not asleep in less than 30 minutes, or if you're still waking up, you should go up to 2 milligrams. Now, this should only be done under the direction of your doctor. But a lot of doctors don't know about these syndromes, so it may be hard finding somebody who understands them and knows what medicine to use. It's not that these doctors are not smart enough or whatever, they just don't have the training that they should be getting about sleep disorders. When I left psychiatric training, I had no idea what a sleep disorder was. I'd never been given any instruction or training, but I sought out nationally based sleep disorder medical education programs where I was able to sort this stuff out. So another medicine that can be used very effectively, if your insurance will pay for it, is a patch called Nupro. And Nupro is an amazing product. It raises dopamine and dopamine receptors 24 hours a day, because the patch is worn for 24 hours a day. And so it's a more natural kind of thing, because you don't have to do anything special to make it work. You just wear it, and you change it every 24 hours, and you go to sleep naturally, and you stay asleep if it works, which it does in quite a few cases. I would say the majority of times. It also has some sexual benefits for people, especially women, because a low libido is caused by low dopamine levels, and this can raise your dopamine level. So not only do you sleep better, you may feel better some other ways too. Another medicine is called baclofen. And baclofen is a old muscle relaxant. I believe it goes back to 60-some years ago when it started to being used for muscle cramps in people with quadriplegia and paraplegia. They get horrendous muscle cramps, and this drug would relieve those. So I'm not actually sure how it transitioned from that kind of thing to sleep disorders, but a good friend of mine who was a sleep specialist, he used an awful lot of it. So these are some of the medicines you can use. What about true sleeping medicines that are advertised as sleeping medicines, such as Ambien? And was another one. I don't know if I can remember the name of it or not. I think it starts with an L. Well, maybe it'll come to me. Ambien had become a pretty famous drug. Lots and lots of people were on it for insomnia. It was, I think, rare that the doctor who prescribed that ever asked the patient any questions about their insomnia, what kind of insomnia they have, how did it affect them, because they just hand them out without any regard to diagnosis whatsoever. So Ambien became highly used, and it also had some real problems associated with it. There were people that had bizarre activities after taking it in the middle of the night. They might cook a meal, they might go for a ride in their car, which they might go outside and walk around and come back, but they had no memory of it, of why that they did these things. Complex behaviors, but no idea that they've been doing them. So a nationally known sleep specialist came to Indianapolis one evening and gave a talk on Lunesta. That was the other drug, Lunesta. And there's some other ones too. But I asked him why this happened with Ambien, and he said it produces partial sleep. In other words, you don't get completely asleep, so part of your brain is still awake. And it's the part that can carry out complex behaviors. So nobody should take any of these sleeping medicines without control and oversight from a doctor who supposedly knows something about them. Ambien can be taken up to 6 months, and Lunesta for quite a long time. But they do have some addiction potential. They are a controlled substance, although they're not heavily controlled. So use them with caution. I never use them except as an absolute last resort. And a young woman had been trying to treat for restless leg syndrome. She just did not respond to anything I tried. Even though she wanted to respond, she didn't get any relief, and I just couldn't bring myself to give her a sleeping medicine that can get her addicted. So I referred her to a leading sleep specialist here in town, and if he thought there were no other options to give one of these medicines, then fine. And that's what ended up happening. He had no choice because there just wasn't anything else available. But it's pretty rare that they have to be resorted to. So now these conditions are not, some of them can be diagnosed during a sleep study for sleep apnea, but all sleep studies aren't created equal. I've seen many that are incorrect or they miss diagnoses. So don't assume that if you've had a sleep study that everybody knows what's wrong with you. You may not. So this is Dr. Michael Deal. I'm going to sign off for now. And if you liked what you heard, please subscribe to my channel and hit the like button and the notification bell, because we're going to be doing many more recordings. And if you have any ideas or comments about what you'd like to see from me as a video, feel free to let us know. So thank you for your time. Bye-bye.